Yes, this meeting is being recorded. And if Sarah McGee will read the notice and also then take the roll of members.
Absolutely. All right. So the Health and Educational Facilities Board of the Metropolitan Government of Nashville and Davidson County, Tennessee, will be held in accordance with Executive Order Number 16, signed by Governor Bill Lee on March 20th, 2020, as extended by Executive Order Number 34, signed by Governor Bill Lee on May 6, 2020, as extended by Executive Order Number 51, signed by Governor Bill Lee on June 29th, 2020, as extended by Executive Order Number 60, signed by Governor Bill Lee on August 28th, 2020, allowing governing bodies to hold meetings by electronic or other means of communication without a quorum physically being present if the governing body determines that meeting by electronic means is necessary to prevent the spread of COVID-19 or other related epidemics to protect the health, safety, and welfare of the public and members of the governing body. All votes taken during this meeting will be by a roll call vote. Now, as Chairman Meyer requested, I'll take roll. Mr. Perry?
Present.
Mr. Brown?
Here.
Dr. Aday?
Here.
Ms. Baldwin?
Here.
Ms. Sharpe?
Here.
Mr. Moth?
Here.
And then Chairman Meyer.
Here.
Perfect.
All right, thank you, Sarah. Our first order of business is consideration of the minutes from our meeting of September 30th. Hopefully everyone received a copy of those. Any questions, suggestions, revisions, or corrections? If not, can I have a motion to approve these minutes as presented?
Move approval of the minutes.
Move approval by Chris Moth. Is there a second?
Second.
Have a second. Any further discussion or question about the minutes? If not, all those in favor of approving the minutes as presented indicate by saying aye. Oh, we need to take the roll. I'm sorry. Sarah McGee, please call the roll on the minutes.
Perfect. So this is for the minutes. Mr. Perry?
Aye.
Mr. Brown?
Aye.
Dr. Aday?
Aye.
Ms. Baldwin?
Aye.
Ms. Sharpe?
Aye.
Mr. Moth?
Aye.
Chairman Meyer?
Aye. And your vote is?
7-0 with approval.
All right, thank you very much. Our next matter of business is a request from Birchstone Village LP for preliminary approval of not to exceed $40 million in multifamily bonds. And this will be their first time before us, I believe, but I'm not sure who is representing Birchstone. So who do we have present that wants to speak for Birchstone? Please identify yourself.
Hi, this is Alex Trent with Trent Development Group, also First Cumberland Properties. This is a single asset borrower. My father, Robert Trent, partner fellow, and have done a few deals in the past, and we're heavily involved in affordable housing in Nashville. But I'm here representing the entity Birchstone Village. And I appreciate your time.
All right, you want to tell us about the project, where it is, how many units, et cetera?
Sure. So we have a development called October Homes. It's in Madison, Tennessee. The actual address is 606 North DuPont Avenue. It's right next to Madison Park. So we own an approximately 100-unit development there. It's affordable housing development. It's done very well, and it's in very good shape. We manage it, own it, and that's traditionally how we handle things. And so this development is on an adjacent parcel that was part of a larger contiguous parcel. And it's approximately 11 acres, 12 acres. And it's actually 3 separate parcels, but they're all contiguous. So we'd like to put approximately 250 to 256 units on there. We've done some engineering and are very comfortable we can fit that on the site. And it'll all be affordable. We'll income average 40 to 80% of area median income. And we think it'll be a very well received addition to the neighborhood.
So this is vacant land and it's adjoining or next to a property you currently own. Is that accurate?
Yes, sir.
Further
Chairman,
questions?
Question
Yes.
here. Mr. Trent, is this an affordable housing, but a low-income housing tax credit project?
Yes, sir.
Okay, because this is a new project, we do have to have a public hearing on this. So I'm going to see if there is anybody who is in attendance, I guess by phone or otherwise by Zoom, that wishes to speak for or against this particular project. Anyone? If so, please identify yourself. Okay, apparently there is no one present. Cindy Barnett, you did not have any contact with anyone regarding this project?
No, sir.
Okay. All right. Further questions from board members? We do have a resolution before us that would give preliminary approval. So at some point, I need a motion if we want to proceed with this project for a motion to adopt the resolution that's before us for preliminary approval.
I will move such.
Okay.
Second.
Have a second. Okay. Any further discussion on the housing in Madison? If not, we'll take the roll call. Sarah McGee, would you take the roll, please?
Absolutely. Mr. Perry,
Aye.
Mr. Brown,
Aye.
Dr. Aday,
Aye.
Miss Baldwin,
Aye.
Miss Sharpe,
Aye.
Mr. Moth,
Aye.
Chairman Meyer.
Aye.
That's a vote 7-0 approval.
Okay, so the resolution is adopted. It's preliminary approval. So I assume you will be going or have gone to THDA for set-asides for this. Is that correct or not?
Yes, sir, we will. The application process doesn't open until early 2021, but we've been in contact with them and are preparing our application as we speak.
Okay, so it'll be 2021. Once you get your allocation, you should come back to this board for final approval of issuance of bonds. Is that correct?
That's correct.
Okay, thank you, and good luck with your project.
Thank you.
Our next order of business is Trevecca Nazarene University, which is asking for an amendment to its prior approval that we approved of $80 million in bonds. Cindy Barnett, do you want to give us an explanation of this, or?
We have Russ Miller with Bassberry and Sims who can provide the board with an overview.
Okay, go
Yeah,
ahead.
this is Russ Miller. We're serving as bond counsel on this project. Also on the call, Mariano Manzu is the CFO of Trevecca. Brad Garrett is on the call as well, though not video. He is with Ziegler and is serving as the underwriter and placement agent for this deal. And then Malcolm Nimick is the Ascension Capital Advisors, and they're the financial advisor to Trevecca for this deal. As Mr. Meyer mentioned, this is an amendment to a resolution that you all passed toward the end of last year. At the time, this was expected to be a roughly $45 million deal. We were expecting to do it as a public bond issue for one series. That was going to finance a dorm and a new health science services center for Trevecca. We had expected to issue those bonds in sort of March, April timeframe of 2020. As everyone knows, that did not end up being the best time to issue bonds. And so we put the project on hold for a little while, and have now, the financing team has come up with, I guess, a thought that it's time to go forward with it now. We're asking for an amendment to the resolution to provide a little extra flexibility in what they're trying to do. But the main thing is the thought now is that they also want to do some pretty substantial improvements to their student center on campus, known as the Jernigan Center there on campus. That would increase the size, and we're asking for approval up to $80 million. That would include capitalized interest and reserve funds, things like that for the project. Also, we had originally thought that this deal would be done just in the public markets. Now, we think at least a portion of it is likely best done as a private placement with a bank. And Ziegler and Malcolm and Mariano are all working hard on a proposal that's going to go out very soon here to banks on these bonds, or a portion of these bonds. That's pretty much the summary of what we're asking. As I said, Mariano is on from the school, and a couple of his financial advisors are on as well. So I'm certainly happy to turn it over to them or turn it over to the board to ask questions about the amendment we're asking
for. This is Steve Meyer again. I'm going to ask Cindy Barnett to just give again a history of what we've done on this before, because this is an expansion of the previous approval. Is that accurate?
It is. Originally, the request was in December of 2019 for less money and a public offering. And now what they're requesting is an increase in the amount of the borrowing. And they've also added some additional projects to be included, and the concept that a portion of the debt will be a direct bank purchase. So it's expanding in a few different ways, the original approval.
Okay, so we do need to have a public hearing on this since we're expanding the project, right? We had one public hearing, I presume, initially.
You did, correct.
And we just gave preliminary approval before. We never given the final approval. Is that right? Or did they
Actually, no, it was a final approval and
final approval
hearing in December. And so because of the increase and the additional projects, you need to have a new public hearing now.
Okay. Have you had any contact from anyone wishing to speak to the board or submitted any information?
No,
Okay.
sir.
Okay. Is there anyone present at this meeting on now that wishes to speak for or against this proposal? Okay. Not hearing from anyone, I'm going to close the public hearing and now turn it back over to any board member have a question. I guess you want maybe somebody from the campus or administration maybe could explain a little bit more about what the project encompasses now.
I have okay, go ahead.
No, go ahead.
Anybody from Trevecca? We have somebody from Trevecca to speak.
Yes, this is Mariano Monsu, and I'm the CFO here at Trevecca. I think Russ went through them, but basically we are trying to improve our facilities on campus. We haven't done much work in the last. Our newest residence hall dates back to 1976. Our student center, cafeteria building hasn't been touched in over 30 years. And obviously we're expanding our PA program by building a new health science facility. So again, we're trying to grow some programs that we are doing very well at and also improve the facilities. So that's what we're here today. But I can answer any questions that you have on anything else.
Okay.
I'm curious about the footprint. Hi, thanks. Thanks, Mr. Chairman. We approved the preliminary approval for exploration of a bond for a residential dwelling across Factory Street from you last time, 3 or 4 store. And I'm just trying to get just an understanding of the footprint of the expansion you're proposing now, because I see in your note that it could it extend to Factory Street? I know you have a new music building, sort of a couple of blocks up the hill from Factory Street. Are you filling in down the hill, so to speak?
Can you ask that again? I'm not sure that I'm following. You mean about the new residence hall location, or?
Yeah, I'm just sort of trying to understand, are you expanding the footprint of the university?
No.
You do these improvements? Okay, because I saw Factory Street was listed on the thing, so that's fine. And then just a general question with this doubling of the project, and I love the mission of Trevecca in Nashville, don't get me wrong, but it is important for this board to keep an eye that we don't creep into the sort of the religious mission of Trevecca when we fund things. Can we be confident that we're just supporting the sort of educational aspect of Trevecca in this?
That's right, yes.
Mr. Chairman, question here on the bonds that we're going to issue. I'm hearing that a portion of them are going to go out in private placement with solicitation to bank purchasers. The portion that's not, what's the plan for distribution or investment in investors? And refresh me, I think Trevecca has an investment grade rating. Will that apply to these bonds as well? Is that still in place?
Well, this is Malcolm Nimick from Ascension Capital Enterprises. You are correct. We are rated BBB-, which is an investment grade rating by Fitch Rating Service. We would anticipate that these bonds would go through distribution by a public bond offering, with the most likely purchasers institutional buyers of mutual funds and other institutional buyers.
And this is Brad Garrett from Ziegler, who served as bond underwriter on the Trevecca public offering last about a year ago. And just to follow on the coattails of what Malcolm just said, as far as the public bond would be entertained, the expectation, yes, again, the investment grade rating would apply. And in rough numbers on the last issue, which was about 22 and change, in the low 20s million dollars, there were approximately, just for what it's worth, about 15 investors that ultimately, distributed allocation. And to Malcolm's point, they were, the majority of all of these were institutional buyers. And I think the expectation would be that would be the same. There would probably be some overlap, some repeat buyers, to the extent that there's a new expanded universe of buyers, given slightly larger bond issuance, but we would expect the same general profile, if that helps for that distribution.
It does, Mr. Garrett. Let me ask a couple more questions. What's the structure? What's the maturity on the bonds that won't be bank bonds? And what's your price expectation there?
Sure. As far as as we approach the structure, and again, that's ultimately the final structure would be sort of still resides in the to be determined camp. but the general thought process would be that we would try to achieve a level overall debt service with the entire portfolio. Right now, the portfolio, that's what we achieved in the 2019 issue. And so now that we would again target a 30-year final maturity. So given that we would be a couple years out, but call it 2 years out further on the yield curve, we would look to fill in those final 2 years. But as we layer, and I guess for lack of a better phrase, layer the additional debt on, we would structure it so that Trevecca has the budget manageability and the expectations such that it would be a level debt service throughout the yield curve, right throughout the amortization. As far as price expectation, obviously there hasn't been a ton of private higher education public transactions done in this COVID timeframe, but we have been running numbers. We're obviously keeping an eye on the market, and I think that the expectation would be that would be roughly the same sort of ballpark. They were able to achieve just under right at a 4%, average yield, if you call it that, across the yield curve, with a lot of 5% coupons, but with investors paying a premium to buy that yield down. That would be about the same expectation. I think the coupon talk at this point is still about the same for these investment grade, low investment grade rated bonds, if that helps. And we'd be glad to provide more, but that's probably where we are at this point.
And, just to remind people that the markets are volatile, capital markets are volatile, and that's based on our expectation today and not making a particular forecast of where interest rates will be when we actually price this issue.
Correct.
And do you have a confirmation, or have you, Fitch is hanging on with you now on this issue?
We have initial indication. They have not given us a final credit rating because they've not seen the full structure yet. But every indication is that we are still maintaining and really they express no concern given that they were overly cautious, to use a paraphrase of their words, in the initial rating. So we're not concerned about being over leveraged to lose that rating.
Good. Thank you.
And then to follow up on that for the benefit of the board and the committee, we did have Trevecca had their annual review with Fitch right at the beginning of this COVID timeframe. So, and so a lot of this is already built in and baked into their analysis, at which time they affirmed the rating. So granted, it's a few months old, obviously, but for the benefit of everyone on the phone, they did affirm that. The BBB- rating, the investment grade.
Thank you, Brad.
You're welcome.
Further questions from board members?
I have one question. I'm not even entirely sure who to direct this towards, since I'm new, and I'm curious. I'm getting that some of this is due to a glitch because of COVID and the delay, but the expansion of the project and the almost doubling of the money requested, is that something that's like a common occurrence, that an organization will come back and say, hey, we've expanded the project and now we need, XYZ amount of money instead of the original amount? Or is this just kind of an outlier because of just the way things fell out due to the COVID circumstance?
Well, this is Brad, and Malcolm, jump in, please, and Mariano, of course. I'll address I think the first part of that, or at least part of it. I hope I can get this in its totality. As we sort of rewind and go back in time to when we first came to the board, the university had sort of a phased, it had a forward-looking capital improvement plan, if you will, which involved several projects and which would
Brad,
have.
could I interrupt? This is Malcolm.
Yeah,
second.
Go ahead.
Is the question about what comes in front of the board generally, and if this is usual, or is this a question about Trevecca? I think it's not. My interpretation was this was not a Trevecca question.
Right. Yeah.
Yes and no, both. I mean, I'm curious about your circumstance, but I'm also curious about how common this is that this happens.
Do we want to let Cindy or someone from the board answer the first part of that question of how common it is for others?
I'm happy to address just more generally. It's not unusual for us to see a lot of repeat borrowers before this board. Their financings are very dynamic, especially for some of the larger institutions. And so their borrowing needs can change as their institutional needs change quickly. So I would say it's not unusual. And in this market, we may see even more of these as strategic plans change, needs change. What they thought they needed 6 months ago for a lot of institutions has changed dramatically. So we may see more of these.
Okay.
It is partly that, it is partly some costs have escalated, and it's also the passage of time as we continue to develop our capital needs. We hope to be a perpetual mission. And so how many times do you renovate or replace a building forever? It's part of our ongoing process to be good stewards of the campus and our neighborhood. So it's really, as I say, increased costs and projects just because of the passage of time.
Does that help? And this, Brad, and I was Malcolm, just the part that I was focused on was the passage of time. As we now assess the expansive project list, which is sort of an ongoing rolling capital improvement plan. The fact that we're almost 11 months, or 10 months, further along in time, and the order of events has changed a little bit. So it was just kind of a function of that, I guess, if that helps.
Yes, absolutely. Thank you.
Further questions? Sorry, I got off the line for just a minute. Cheryl, did you get your question? I think we have had some, I don't know if anybody mentioned, we probably have had a few cases in the past where circumstances changed and people came back with a different project. Not terribly unusual.
Yes, thank you.
And, sometimes the bond market too, being what it is, people can borrow at lower rates and say, well, let's go ahead and do this other project, or because the rates are low at the present time. Further questions? We have a resolution that was presented or mailed to us, which we need to have a motion if we want to consider this matter further. We need a motion to put the resolution on the floor.
So moved.
Is there a motion to adopt the resolution? There's a motion to adopt. Is there a second?
Second.
Second. Okay. Further discussion? Questions? If not, I'll assume everyone's ready to vote, and we'll ask Sarah McGee to call the roll on the approval of the resolution for Rebecca Nazarene.
Mr. Perry?
Aye.
Mr. Brown?
Yes.
Dr. Aday?
Aye.
Miss Baldwin?
Aye.
Miss Sharpe?
Aye.
Mr. Moth?
Aye.
Mr. Meyer?
Aye.
The vote is 7-0 in favor of approval.
Okay, so the resolution is adopted, and this was final approval, then, right? So
Correct.
yeah. So you all go. Good luck with the project. Hope the bond financing goes well, and we'll look forward to seeing progress there at Rebecca.
Thank you.
Okay, our next matter of business is a proposal from Harding Academy. We're authorizing documents. This is an expansion in connection with their request for amendments. So this is some amendments. Do we have somebody from Harding Academy with us?
Yes, this is David Skeen. I'm the head of school at Harding Academy, and Charles Momus, our assistant head of school for finance and operations, is also on with us.
Okay, do you want to tell us what you're doing here?
Sorry, Mr. Meyer, this is Russ Miller. I'm on as well, and I'm
Okay, you're handling this.
we're bond counsel on this transaction as well. Just like you said, this is an existing bond issue that the Health and Ed Board did in 2019, closed in May of 2019. That deal was a refinancing of some prior debt that they had from 2012 that was primarily to construct a new middle school for the school. Did some other projects around campus, but that was in 2012. They refinanced that in 2019 with these bonds, and now they're seeking an amendment to that bond. So these bonds were placed with SunTrust Bank, now Truist. I believe Robert Rigger is on the phone from Truist Bank as well. The school and the bank have agreed to reduce the interest rate on these bonds. It's fixed rate currently at 3.5%, and Truist is reducing the rate to 2.75%. And that results, it's on a mortgage style amortization, and so reducing the rate ends up in shortening the amortization schedule a little. These bonds were originally issued at around 3.8 million. They've been paid down to around 3.6 million now. As I said, sort of mortgage style amortization. And that's really the extent of the amendments we're asking for. There's no new money or anything like that with this amendment of their existing deal.
Okay. I'm going to ask Cindy Barnett to just explain to us what we're amending in our documents or whatever. We have a resolution here, right?
You do. I mean, this is changing one of the fundamental aspects of the outstanding bond and the note from the school. And so it needs to come before the board. There's a bond and loan purchase agreement that was executed last year. And so this is amending that document. And so that's why it's coming before the board.
Okay. Does anybody have any questions then about what we're doing here? Essentially, though, it's resulting in an interest rate reduction for Harding Academy.
I missed the Russ, did you say that the original? I missed the original size and how much debt has been paid over this relatively short period. Is it about $1.2 million has been paid?
No, 200,000. It went from about 3.8 to 3.6.
Oh, okay, 3.8 to about 3.6.
Yeah.
Got it. Okay.
The original debt, when it was issued for these projects in 2012, it was 7.2 million was the original amount, and so since 2012 they've paid that down to now 3.6.
And is the philosophy with the renegotiated interest rate just because of the successful payment history, and then those savings are just sort of recouped through the school's operating budget? Is there a special allocation for it, or is just generally saving money on interest expense is a positive thing?
Yeah, I mean, it saves the school, significant money over the course of the loan, and we want to take that opportunity.
Okay, is there a motion to adopt the resolution?
So moved.
Okay, it's moved for adoption. Is there a second?
I'll second.
Second? Okay, any further discussion? Questions? If not, Sarah McGee, please take the roll.
Is there a public hearing, or are we going into vote? I'd like to make a quick comment if we're about to vote on this.
No, there's not a need for a public hearing. This is not a new project. We're just amending some documents. So, but go ahead. You certainly welcome.
Yeah, no, I just wanted to recall that when we voted on this back in February of 2019, we initially voted 3-3 after a fervent discussion around the nature of private education, K through 12 fundamentally and exclusive. And then after discussion, the bond went through 4-2. You know, Harding Academy is just such a wonderful institution. That is not in doubt. What is in doubt for me is still whether we should be allowing the federal treasury to support financing of bond issues, which are for inherently private and exclusive organizations. Certainly they don't support country clubs. Why should we be supporting private schools? So my plan is to continue to vote no against these kinds of bond issues while I'm here on the board. That's it. Thanks.
All right. Anybody else? Okay. If not, Sarah, would you please take the roll?
Sure. Mr. Perry?
Aye.
Mr. Brown?
Aye.
Dr. Aday?
Aye.
Miss Baldwin?
Nay.
Nay? Or yay?
Nay. No. It's a no. Nay.
Sorry. Miss Sharpe?
No.
Mr. Moth?
No.
Chairman Meyer?
Aye.
That's a vote of 4-3 in favor of approval.
All right. Thank you, Sarah. All right. That'll conclude the amendments there. Then finally we have the next matter before us is authorizing documents relating to the request from HCA or HCA Realty, which we did a project quite a number of years ago, as I recall, relates to the them trading the Lentz Health property that the former Lentz Health Center was on, giving that to HCA, who then provided Metro or the health department with new property where they built this new facility, which is across from HCA on Charlotte Avenue. You may be familiar with the Lentz Health Center on Charlotte, as I say, really across the street from where HCA is, and they in turn swapped the plant where the old property was, and HCA got it. Now, Cindy Barnett, can you explain what the request is here?
I'm going to let Scott Rayson, who's here on behalf of HCA, explain their request, but we have a lot of amendments today. This is also in the category of what I would say an amendment. They were before the board in 2014. And so they're coming back pursuant to documents that were approved then. And Scott, with that, I'll let you take it from there.
Okay, thanks, Cindy. Well, I'm Scott Rayson. I'm at Waller, and I'm also joined today by Justin Coury, who is the CFO of Centennial Medical Center, which is what this project supports. So as the chairman said, in 2014, HCA and Metro did a land swap. And as part and parcel of that, Metro agreed to do a payment in lieu of tax agreement with HCA Realty so that HCA would get the benefit of what amounts to lower taxes for the property for a 10-year period, although the 10 years didn't begin for a few years. And the idea when this land swap was done and the payment in lieu of tax agreement entered into, which is also with this board, was that at some point HCA would make a material development on this property to benefit Centennial Medical Center. And at that point, the real benefit of the payment in lieu of tax agreement would commence. So as the way I realize that this board doesn't do a lot of payment in lieu of tax agreements. And by the way, Cindy, I realized the other day after we spoke that the first time this board did a payment in lieu of tax agreement was for HCA as part of the package to keep the headquarters from moving to Louisville when they merged with Columbia. Anyway, so for this project, there's not a loan from the Health and Ed Board to HCA Realty. Rather, the Health and Ed Board owns the property nominally, really, and they lease the property to HCA Realty. The reason for that structure is that by holding title to the project, the project is exempt from property tax. So that's why we agree to make a payment in lieu of tax. So we pay an increasing amount of the property tax that we would pay if we owned it. When the project was, when this transaction closed in 2014, the property was worth about $6,150,000, which is the principal amount of the bonds that were issued at that time. And now HCA has just developed a significant parking garage, which I'm going to let Justin describe, and really the whole medical center. So the cost of that project was $63.5 million. And so the request for the board is that you issue bonds in order to what's legally called financing the costs of that project. And these the bonds are these are a necessary aspect of getting this payment in lieu of tax benefit. The law has actually changed now, so if this were brand new, we wouldn't have to go through the bond issuance. One other comment is that unlike Trevecca's bonds, for example, these bonds are not marketed to the public. Another HCA entity buys the bonds. So on one hand, you have, HCA Realty will make lease payments in the amount of the principal and interest on the bonds, which are then assigned to another HCA entity. So there's no true financing going on. There's no concern about the credit of the participants and that sort of thing. So that's the sort of the gist of it. In terms of the documents, the bonds, the original bonds were issued pursuant to the lease agreement. And the lease agreement provides that if and when we come back to the board to finance a project like this, the board has agreed to issue the bonds. So what we need to do in terms of documentation is that we'll enter into an amendment to the lease, which simply provides that the board will be issuing these bonds. And then of course there's the bond itself, and there's the agreement pursuant to which the purchaser, the HCA sub, buys the bonds from the board. So Justin, I'd like you to talk with the board about the hospital and the impact of this project.
Thank you, Scott. Can you hear me?
I can.
All right. Thank you. And thanks to the board for having me. Thank you for your service to our community. My name's Justin Coury. I'm the Chief Operating Officer at Centennial. I've been in this role for just over 3 years, been with HCA almost 10. We're a 741-bed tertiary medical center between 22nd and 25th Avenue, predominantly in Patterson, up to Charlotte. We are HCA's first hospital. Dr. Frist founded the company very close to where I'm sitting, actually, in 1968, and started the first hospital on this campus in '69. Now, of course, we're part of a network of 185 or so hospitals. This particular hospital, Centennial, is one of the most comprehensive in HCA and one of the top performers in our company as well as across the country when it comes to patient experience, outcomes, clinical outcomes. et cetera. We're part of the TriStar network, one of 19 hospitals in TriStar. We serve patients in Tennessee, obviously, Alabama, Georgia, Kentucky, Mississippi, 30,000 plus admissions a year. And about a quarter of our patients come to us from outlying facilities because of the high level of care that we offer and the complexity of care that we offer. For example, heart and vascular, we're a national leader in cardiovascular surgery. Our extracorporeal membrane oxygenation program, ECMO, this is a new program for us over the last couple of years. It's a heart and lung machine that is keeping patients alive, some of the sickest patients in hospitals. And we're now using this with COVID patients to help them get through their battle. So we're an innovative learning institution. We're embarking on graduate medical education, and services span across women's. We have the Sarah Cannon Cancer Institute, behavioral health. We have one of the larger behavioral health hospitals here on campus. We have a children's hospital and a major orthopedic joint replacement institute. We have the highest rating from the Leapfrog group when it comes to patient safety, and we've earned that rating for the last 8 years. And we've grown rapidly with the unprecedented growth in Nashville over the last several years. Centennial has grown along with the city in order to accommodate the demand for services. And we've added 4 floors on our main tower since I've been here. I've helped manage around $300 million in capital, expanding the services that we offer here. And I'm here to speak today about the growing pain that came along with that was incredibly significant. And I remember joining the institution here in August of 2017, and parking and the constraints and the effect on the patient experience was very significant. You can imagine coming to a hospital is already anxiety provoking. Coming into an unfamiliar territory in the city is anxiety provoking. And this became our #1 complaint, whether it was through Google reviews or Press Ganey surveys or calls to administration or in-person visits to administration. Our physicians were frustrated, our employees, and certainly our patients. So we partnered with a third-party consultant. Just to give you a little background, we had about 5,000 parking spots across this campus, 6 parking garages, and 21 lots. But more than half of those lots had less than 100 spaces. So again, you're coming to this massive facility, and you're going into a very small parking lot with an even smaller number of available spaces, and dealing with your medical issue or your family's anxiety, patients missing appointments because they ended up on the wrong side of campus, et cetera. So we identified almost a 2,000 space deficit for parking capacity. As of note, there are about 5,000 to 6,000 people on this campus per day. So we set out with an architect and designed the plan for an 8-story, approximately 2,300 space parking deck. We received funding for that. The deck has a connector into the main tower of the hospital and our busiest medical office building. And our strategy from the get-go was to get patients closest to their destination. We cannot have the sick walking across campus to get to their destination, get to their care. So that's been the strategy since the beginning. We created a parking allocation plan to get our employees allocated in order to free up spaces nearest to the patient's destination for patients and visitors. We've invested a few $1 million since then in a campus wayfinding or signage plan. So we're redeveloping the signage around campus in order to make it a better experience for our patients. And I can tell you, having led the project and having responsibility for parking operations and overall operations, we have had virtually zero complaints about parking since this garage was built. Our patient experience is now in the top decile nationally, and I do think this was a major contributor to that improvement. And thank you for your support, and I'll be glad to take any questions.
All right, this is Steve Meyer again. So Cindy Barnett, again, refreshing our history on this project. And so the parking garage has been built, and now we're financing, we're issuing bonds for that of $70 million. Is that correct?
That's correct. It was contemplated when this was done in 2014. And also just a reminder, this particular project was subject to council authorization and approval. And the council actually directed this board to enter into this arrangement with HCA. The board didn't come up with this idea. Under our charter, the board cannot do these types of arrangements unless directed by majority vote of the council. So the council directed the board to do this.
Yes, I recall the council's involvement, and we were asked to do this. And at that time, all we did was agree, or the property was deeded to us, right, so that we own it and lease it to HCA or HCA Realty. Is that right? We took deed property and did not do any financing at that time, and now we're called on to do the financing now that the project is completed. Is that?
There was a financing in 2014, but it was not it did not include the improvements on the site.
Okay,
there were no improvements.
Right. It was the parcel. It was the acquisition of the parcel.
Okay.
Cindy or Scott, is it fair to say that this pilot program is something that has been negotiated and agreed upon between Metro government and HCA, and we're really just the underlying technical infrastructure to affect that agreement?
That's correct. Yeah, we were not part of any of those negotiations. The board was not. This was negotiated between Metro and HCA.
And by the way, the reason that we have done this project through this board is because it's a healthcare facility project. The Industrial Development Board has the authority to do lots of different projects. This project really didn't fall within the scope of what the IDB could do. Its authority may be a little broader now, the definition of projects it can do, but it certainly wasn't at that time.
So we have a resolution presented in our pack and we do not need to have a public hearing. Is that correct, Cindy?
That's correct. This is not tax exempt debt. This is taxable debt.
Taxable debt. Okay.
Correct.
Chairman Meyer, may I just ask one and because we don't see many pilots, apology, Scott, if I missed this in your initial overview, but in 2014, I was a newbie board member and I remember we had this and we had the life flight helicopters were the two that didn't look like everything else we did. And there was a decade or so that the tax savings or that the pilot could be, that was the maximum term of the pilot, right?
Well, you're correct. Because we didn't anticipate having any improvements built on the property for several years, the idea of having a 10-year payment in lieu of tax agreement that began in 2014 would mean we would use most of that payment in lieu of tax period to save a little property tax on an empty lot. It was paved, that was it. And so the agreement with Metro that again was approved by the council was that HCA could basically, it could say when the 10-year period would begin, it only had 3 years within which to do that. So the pilot runs through 2026, and that's the reason that a 10-year deal that began in 2014 will end in 2026.
So I've heard that this is sort of a statutory setup. You need it to be a bond structured by this board so that you can satisfy requirements that have existed in the past. I'm fascinated that it's sort of on the one hand taxable, but on the other hand all internal. I mean, do you loan it to yourself at 0%, or do you have a negative interest rate and take a loss?
Well, for financial accounting purposes, there's no impact at all. There's a payment out, there's a payment in, there's, so interest out, interest in. So and the bond, the interest on the bond is taxable because this project is not eligible for tax exempt bonds. Or we couldn't sell the bonds publicly and get a tax exempt rate. So there is no implication of the federal government subsidizing this project. And let me say, there's also no implication of the federal government subsidizing any aspect of this project. So, and I think that I think HCA will pay more payment in lieu of tax on this one facet of this project than all the other hospitals in town will pay for the same period.
Further questions? If not, is there a motion for the resolution?
I'll move.
Second.
Moved and seconded. Any further discussion? Not, Sarah, would you please call the roll for the vote?
Mr. Perry?
Aye.
Mr. Brown?
Aye.
Dr. Aday?
Aye.
Miss Baldwin?
Aye.
Miss Sharpe?
Aye.
Mr. Moth?
Aye.
Mr. Meyer?
Aye.
That's a vote of 7-0 in favor of approval.
Okay. Thank you all very much.
Thank you very much.
Thank you.
So that concludes our regular agenda of projects before us today. Any old business, Cindy Barnett, on our calendar?
No, sir.
All right. Any new business from you or anyone?
Not at this point. I think we will be getting in touch with you. We're probably going to need one more meeting between now and the end of the year for one of our housing properties that came before us for a preliminary that may be ready to proceed to final. But we're not ready to schedule that at this time, but we'll be in touch about that.
Is that the only project you see coming back for final approval between now
That's
and
the only one that we've been contacted about. Yes, at this point, that's all we know. That could change tomorrow, but.
Yeah. And of course, you got information on our state reports, which were mailed to everybody. I want to take just a few minutes to thank Dick Brown for his service on this board. I don't know how many years it goes back. I know we've been together many years, but knew Dick before our joining on the board. But Cindy Barnett, do you know how many years service Dick has on this board?
I do not. I think we should make him tell us.
Do you know how many years, Dick?
I think I do, but who's counting?
All right. Well, his term expires, actually, I guess expired September 30th, continues to serve. There are, the council will be considering board member or new board members, appointments or elections, I guess, election of new board members at its next meeting. But Dick has chosen not to seek re-election to the board. So I just want to take this time to thank him for his very diligent, served as secretary for quite a number of years too, and has been very diligent at making meetings, and certainly knows his background in finance, has always had good questions as to how the financing is structured, and knowledgeable of Nashville too, to know where projects are. And so thank you, Dick, for your service to the community and certainly service to this board.
Thank you, Mr. Chairman, for those kind words. Once again, it seems my reputation exceeds me. I've enjoyed all of it, and working with everyone that's been on the board, through the board, and serving the board and presenting to the board, like Mr. Rayson even. So
good to see you.
Thanks very much, everyone.
Okay, there being no further business to come before the board, we'll stand in adjournment until further notice of our next meeting. Thank you all for making the efforts to connect here today, and don't know when we'll be able to have a in-person meeting, but I guess this, as long as I guess when the governor provides that we can and should do this, we'll continue to meet virtually by this method. Thank you all again, and be safe, everyone.
All right, everybody have a good evening.
Thanks, Dick. Take care.
Good night.